Imagine lying on a rolling bed, staring up at the ceiling tiles as you are wheeled through a set of double doors. The air suddenly turns crisp and cold. The lights above are blindingly bright, and around you, a team of masked strangers is moving with absolute, silent precision. To most people, the operating theater is a place of mystery and intense anxiety. But to the medical world, it is a finely tuned stage where a life-saving symphony is performed every single day. To understand how exactly this symphony works, let's follow Sarah. Sarah is 28, and right now, her appendix is highly inflamed. She needs a routine laparoscopic appendectomy, a simple procedure to remove it. But while the surgery is standard, the dance happening around her is incredibly complex. Let's pull back the curtain and meet the cast of characters keeping Sarah safe. It's 15 minutes before the first incision. The room is a sterile sanctuary, kept at a chilly 65 degrees Fahrenheit to prevent bacterial growth and keep the heavily clothed staff comfortable. Right now, Sarah is meeting the person who will guide her into deep sleep, the anesthesiologist. The anesthesiologist and nurse anesthetist, they don't just put you to sleep. They are the guardians of your vital signs. They monitor Sarah's heart rate, blood pressure, and breathing every single second, adjusting a complex cocktail of medications to ensure she feels absolutely zero pain and wakes up safely. Over by the instrument tray, we find the hands of the operation, the scrub nurse. They are entirely sterile. They know the surgeon's preferences by heart and hand over scalpels, clamps, and sutures before the surgeon even has to ask. Moving outside the sterile field is the circulating nurse. Think of them as the manager of the room. Because they aren't scrubbed in, they can move about freely, managing documentation, fetching extra supplies, ensuring patient safety, and keeping the entire room communicating. Time 0. Sarah is asleep. The circulating nurse calls for a timeout. The entire room stops what they are doing to loudly verify Sarah's name, her date of birth, and the exact procedure being done. Safety first, always. Now enters the lead actor, the surgeon. The lead surgeon, armed with years of intense training, the surgeon makes 3 tiny incisions in Sarah's abdomen. They insert a tiny camera and specialized tools to carefully detach the inflamed appendix. The surgical assistant. Standing directly across from the surgeon is the assistant, often a resident doctor or physician assistant. They hold the camera steady, they retract tissue and provide the extra pair of eyes and hands needed to make the cuts clean and precise. While the surgeon cuts, the room itself is working. The anesthesia machine breathes for Sarah. The heart monitor beats in a steady, reassuring rhythm. If that rhythm changes by even a fraction, the anesthesiologist instantly calls it out, and the team adjusts in real time. It is a masterclass in high-stress communication. No one yells, everyone acts. 45 minutes later, the appendix is out, but the job isn't finished. Before a single stitch closes Sarah's skin, the scrub nurse and circulating nurse loudly conduct an instrument count. Every sponge, needle, and tool is accounted for. Nothing is ever left behind. The anesthesia is dialed back. Sarah takes her first independent breath and gently wakes up. She is wheeled to the post-anesthesia care unit, completely unaware of the intricate dance that just took place. To Sarah, she just closed her eyes and woke up cured. But behind those closed eyes was a team of highly skilled, deeply dedicated professionals who worked in perfect harmony to protect her life. The next time you see a hospital drama on TV, remember, the real magic of the operating theater isn't the drama. It's the flawless teamwork. For more amazing and fascinating insights, stay connected to Scary Surgery Stories. See you in the next one.